Manish,
Yeah.
this is Dr. Dipankar Datta. I have a question for you.
Yeah.
Is measuring left atrial strain a challenge in presence of atrial fibrillation?
Yes. See, for one single view, if we are just looking at four-chamber view, it should not be a challenge unless the heart rate is very fast. If the heart rate is reasonable, 70, 80, 90, there won't be any problem in that. Because the method that we use, it is based on our QRS, QRS based method that we use, so should not be a problem. But if you want to combine four chamber and two chamber, then it will be a challenge unless the cardiac cycle length is similar.
But what strain are you measuring? You are measuring just the
Reservoir strain, reservoir
reservoir
strain.
strain because the
Yeah.
booster will be gone.
Yes, reservoir strain is the most useful parameter so far. Maximum data is with that only, and that is the most reproducible also. So that can be measured in patients with AF also.
Perhaps reservoir strain is the only way we can escape in assessing the LV function. That is what LA function in AFib situation. That is what I personally feel. That will only give us the escape route.
Yeah.
Hi, Manish. A very good
Hello.
presentation.
Thank you. Good evening.
Manish, actually, Dr. Dey here.
Yeah.
Actually, nowadays the recommendation is only from the same single chamber view, only four chamber. You do not have to do the same two chamber view, because in the latest article in the 2020 in the LA function in the AAC, they have recommended only from the single view.
You're talking about LA strain or LA volume?
LA strain.
Yeah, LA
volume
strain.
Volume is always from both the chamber.
From biplane. Yes, for most of the studies have been mentioning only four chamber view.
Yeah, only four chamber.
Because of simplicity and
reproducibility, particularly.
And reproducibility also. Yeah. But actually, main challenge is to select cardiac cycles properly so that we can obtain accurate measurements, reproducible measurements, and also representative measurements of the cardiac function that the patient has. And that remains the most challenging task in AF.
Any more questions?
Can you do that? Suppose there's a 5 strain in the 5 views, 5 clips. So that will be averaged. So there will be chance of error will be less.
Yes, if we take average of 10, the reproducibility will increase even further, which is what the guidelines recommend.
Even in strain, I'm telling you.
For everything. For everything.
But it's of course a tedious job doing strain in
It's very tedious. It's going to be very tedious.
So, if there are no more questions, we will conclude the symposiums for the day. We've had a really great day with great discussions and great topics being discussed by the best of the speakers. We conclude the day by making an announcement that all these discussions will be available in our website from the 8th of February for a limited period of 3 weeks. So people can go through them subsequently. We meet again tomorrow at 4:58 p.m. for tomorrow's sessions. Good night.
Good night. Good night.